94.9 KCMO, Kelly and Mackenzie, very happy to welcome Dr. Allison Edwards and Dr. Ryan Newhuffle to the studio. Good morning.
Hello, good morning.
Good morning.
Thanks for joining us, guys. You guys have this great program set up that is something I haven't heard of before. Tell us about it.
Yeah, Sesame Care is a marketplace for people looking for healthcare services. So basically people can go on the website, much like they would Expedia or another type of shopping service, and find a doctor and book it and pay for it right there.
So you know ahead of time exactly what you're going to pay. You never know that in healthcare.
Yeah, it's a novel concept for sure.
That's why we're absolutely excited to bring it to the Metro.
And what was behind this? Because I know there's a huge national debate about healthcare and all this going on. And you said maybe we can do it better. Is that the thought process or what?
Yeah, really, it's a practical solution to problems that people have. People are very frustrated. Both patients and doctors are frustrated with the healthcare system. So this is a way that they can kind of cut through all of that normal red tape and bureaucracy and find a doctor and book and pay for it online. So it's kind of bringing the normal consumer experience to healthcare.
Right. I had a procedure done last week, and I called ahead of time, and I said, how much is this going to be? And I knew no one could tell me, anyone.
That is so frustrating.
Right. I'm like, you don't go to the grocery store without knowing this is how much my bag of Cheetos is going to cost.
Yeah, right.
You shouldn't eat Cheetos, by the way.
Says the doctor.
But you know what I'm saying. But
Can you imagine if you got a bill for those Cheetos 2 months later,
Right,
and like
exactly.
$40?
Yeah.
You're like, whoa, never mind.
Exactly.
Yeah.
Yeah. This is the only business model where that happens is in healthcare.
And doing this yourself, how do you make this affordable for people? Because everybody knows healthcare is outrageous depending on what you have.
Yeah, lots of ways. Number one, a lot of healthcare is not healthcare; it's administrative costs. And so every doctor can tell you about the army full of people there just to bill insurance companies and collect co-pays and do all that stuff. So this kind of cuts all that out.
Wow.
It allows them to offer more affordable pricing than they would billing insurance plans. And also doctors sometimes have availability. You know, they have a light afternoon, and if they don't see a patient, then that goes unused. So that this way they can also find a patient for that slot and make it more affordable for them.
Sounds like you found a way to cut through a lot of red tape and get stuff done. And people the reception has to be amazing from people that you talk to.
It is actually, we've got a lot of, is this a scam type questions, right? And it's not. And the way that we're doing this, like Dr. New just said, is just that we're really trying to take all the intermediaries out of the equation. We're taking all the hands out of the cookie jar. We're trying to make this as direct a relationship between patients and physicians, which is just, I think, the goal that everybody wants to pursue in healthcare.
Oh, that's fascinating.
Yeah, you've got options like radiology, you've got x-rays, dentists, how far? Yeah, it goes all the way.
Pretty much the whole gamut. So primary care doctors, specialists like cardiologists, orthopedists, allergy doctors, other providers like dentists, optometrists, physical therapy, talk therapy. So you pretty much think of it, our idea is this is a true open marketplace, like a grocery store. You can find your Cheetos and your milk and hopefully some vegetables and fresh fruit along the way.
I should never have said Cheetos.
Yeah, no, it's fine. I'm not going to let it go.
We love Cheetos.
Sometimes I eat Cheetos too. So it's a whole open marketplace.
And I'll add that we've had a really robust response from the independent practices here in the Metro who've really enjoyed the opportunity to sort of free themselves from a lot of these bureaucratic restraints and really focus back on the patients. So it's awesome to get small businesses in the Metro involved.
How can people find out more if I hear this sounds almost too good to be true. Like you said, people think it's a scam. I'm just saying right now, I have two doctors in front of us. This is a real deal. Yeah. How can they find out more information?
Yeah, sesamecare.com.
Sesamecare.com.
Yeah, and we want to make it familiar to them. So when they go to the website, they'll think, this looks like a normal website if I were booking a flight or a hotel, and that's how we want them to make it feel. So the website's a good place to start.
Yeah, I was playing with the website a little bit earlier today. It was so simple, even I can use it. Very user-friendly. Very user-friendly.
All right, it's sesamecare.com. This is local. This is not a giant national conglomerate. You guys are doing this here in Kansas City.
Yeah, Sesame Care is a technology platform, kind of like Airbnb or Expedia. And because Kansas City is so awesome, they decided to launch it first here. So that's why. Yeah.
Started with Google, starting with Sesame Care.
There you go.
Exactly.
Right. Well, Dr. Edwards, Dr. New, thanks for taking the time to talk to us. We wish you nothing but the best. Keep us informed with what's going on and onward and upward, okay?
Thank you.